the families have to figure out how to be supportive of the person. You can't spoon feed where they don't need to be spoon fed. You need to interact with the patient and see what they need you for. And sometimes they need you to give them space. Sometimes the patient's very depressed and just needs to be depressed, needs to react because in fact, they're having a funeral of themselves. Their prior lives are gone. And they may be able to reinvent them, and they just may need the space from the family. So they need to not do too much, but to inquire and say, well, what can I do for you? What is it you want me to do? And sometimes it's giving them space. Sometimes it's making sure that they can have the access to the therapy, that they have the access to the comfort, the access to the food. Sometimes they just want to talk. Sometimes they don't want to talk to family, but they want to talk to a professional. Sometimes they're not feeling well and they can make choices about whether they want to take medication or live through whatever they're going through rather than take the medication. They want the choice. Choices have been taken away from them. You don't want to force anything upon them. You want to give them the choices because that's what they've been stripped of even more than any strength or independence. They've been stripped of their ability to make a choice because they've made choices ever since they're 5 years old of what they want to do, what kind of shoes they wear, they don't want their life just scripted for them. So families can't squeeze too tight. They got to give them enough leeway to allow them to make the choices, to allow them to recreate themselves.